I have the honor today and the pleasure of speaking with Christopher Williams, the visionary, founder, and executive director of Heart, Body, and Soul, Inc., a Brooklyn-based non-for-profit dedicated to improving Black men's health. Christopher is also the creator of the Black Men's Health Festival, an annual event focused on raising awareness about health issues with the Black community. With over 25 years of experience in media, financial services, recruitment, and project management, Christopher brings a wealth of knowledge and passion to his advocacy work. His personal journey through significant health challenges, including 2 heart attacks and stage 3 appendiceal cancer, has profoundly shaped his mission to dismantle healthcare disparities and foster open conversations about mental and physical health among Black men. Join us as we delve into his inspiring journey and the impactful work of Heart, Body, and Soul, Inc. And this is what I'm talking about, people, that we are created for more. Okay? We are created for more, and Christopher Williams is going to tell us about his more. Chris, good morning.
Good morning, Syn. Man, I feel like I'm gonna have to pay you to be my to introduce me everywhere I go.
So, Chris, I had the pleasure to see you this past Saturday as we kind of ushered in the beginning of Caribbean American Heritage Month. So I want to start. I want to start there. One. You and your father, your family are instrumental in flying our Caribbean flag high here in the New York tri-state area. And for my listeners, my Caribstar All-Star family, Chris's family, his father and mother, they started Where It's At magazine, which is a free publication that you can get New York City, New Jersey, and Connecticut, and they've been doing this for years. Chris is no stranger to us here, Irie Jam Radio, Caribstar. So Chris, and Chris is... We're in the same age range, I want to say, Chris. So I want to know what it means to you, right? Growing up here in the 90s, being Caribbean American, right? What does that heritage mean to you?
Yeah, so before I answer that, I want to highlight something. So yes, so Where It's At was started by my mom, my dad, Annette Gordon, and myself back in 21 years ago. So much love to them. And of course, my mom is
hear that? 21 years ago.
Yeah. My mom is unfortunately no longer with us, but she's with us in spirit. And yes, I just wanted to say that. But I mean, you said? What was the question? What does it mean to
celebrate being Caribbean American as we're celebrating Caribbean American Heritage Month?
You know, it's a beautiful feeling, right? Because there's so much to being Caribbean, right? You have the folks who are proud of the island they represent, whether it's Jamaica, Trinidad, Barbados, the Haiti, so forth. So you're proud of where you're from,
for sure.
But then the uniqueness of our culture, being of the Caribbean diaspora, the food, the music, just everything that comes from the culture. It's a great experience. It's something that, unless you're Caribbean, you can't really understand. You can want to understand, you can want to feel the vibe and want to go to Carnival and experience it and so forth. But when you're from there, when you're from Barbados, it's a different vibe. When you're from Jamaica, it's a different vibe. When you're from Haiti, you know what I'm saying? It's a different vibe. But Caribbeans in general can relate because there's a familiarity. There is this feeling of pride and passion and so forth, that you can relate to,
For sure. So Chris, we're talking about, I just heard something in my headphones. Chris? So we're talking about more, being made for more. We're talking about what it is to hear that inner voice, what it is to that tug and pull on your heart, what it is to step out and step into greatness. Yes. And as we celebrate
we got disconnected.
Okay. No worries. You're back. And we're back. We're talking about being made for more. That is my phrase of the week, being made for more. And Chris, I want you to talk about what that phrase means to you. We're going to talk about your event coming up, but I want to talk about what being made for more means to you, because just listening to what I'd read or listening to what I just read about you, you know, the health challenges that you would have faced and the advocacy work that you do, there's something that was that there was an inner voice that said, Chris, you need to step out and do more. So talk to us about that.
You know what's funny, Syn, is that I always thought I knew what my purpose was. So that question, made for more, is deeper than anyone could ever believe. I wasn't clear. I thought I was clear. I thought, you know, media is my thing, entertainment, you know, events, that's my thing. So yeah, man, that's what I'm doing, and I'm living. And I thought all this time that I was really truly living. Come to find out I wasn't. Come to find out I didn't really have a true understanding of what my purpose is.
Wow.
Until I would have to say my second heart attack and my battle with cancer.
Wow.
I was in 2021. September of 2021. I was diagnosed with appendiceal cancer. They didn't know, and basically what that is cancer of the appendix. They didn't know then that it meant that I was stage 3, because you know you have to have the surgery first, and then they determine the pathology, which is where they tell you the stage. So now for me, it gave me a better understanding, really, of what it is to be on this planet. You know, having those close brushes with death, because they were maybe a little bit more than a brush. They were really near death experiences.
Wow.
Those things kind of illuminated. It made everything clearer for me.
Yeah.
It illuminated my path and gave me an understanding that there's more to life than what I was doing, and there's an actual purpose for me. So, you know, what it did was told me that in spite of this pain or this challenge that you're feeling, Chris, there is something else you need to be doing.
Yes.
I didn't know what it was until it literally came to me. And I've heard people say this all the time. Oh, you know, it's like God spoke to me. And I'm not gonna sort of diminish the power of it. But the reality of it is that it was a voice that spoke to me, and I will say it was God. I will say it was God within me. I will say it was my ancestors. It was a divine sort of intervention that said, you need to do something. And it was clear to me that seeing the challenges that are faced in our community, specifically communities of color, where Black and brown people are not getting access to the things they need to get access to, that I needed to highlight the problem. And I need to focus on men, because unfortunately, Black men are more predisposed to die from heart-related conditions, prostate cancer, colon cancer, due to lack of advanced screenings, due to, you know, not seeing the doctors enough, not having a primary care physician, and so forth. So I wanted to change that. I saw the problem and I wanted to do something to fix it. So for me, that was my more. That was my call to do more and to live a different way.
And first, I want to thank God for sparing your life, right? And calling you to do more. And the vision for you to do more. I want you to talk about that. I want you to talk about the vision to do more. And that came in the way of Heart, Body, and Soul Inc. Tell us about the Heart, Body, and Soul Inc. and the Black Men's Health Festival that is coming up.
Sure. So I started Heart, Body, and Soul Inc. as a Brooklyn-based 501c3. So we're a nonprofit. We're based in Brooklyn, but our mission, you know, which is to really ensure that Black men have quality access to care, are able to advocate for themselves, and we sort of break down the walls of communication to make sure that they're talking about the issues that they're facing, whether it's mental or physical health, and they're sharing that information with doctors and people in their families. So those are some of the things that we're very focused on, making sure that we have that level of impact in the community, and we can help improve the outcomes for Black men as they go through their life on a daily basis. Now, we're starting with Black men, but we're expanding later on as we build this to men of color in general. But Black men have sort of the greatest problem right now, and being a Black man myself, I wanted to make sure we highlight that. The festival that we developed, which is our signature event of the year, is the Black Men's Health Festival. Appropriately called so because, like I said, the plight that's there is really on Black men, and we started this event in 2022, and it's been fantastic, because what we do is as you go around, you see a lot of health fairs. There are a lot of health fairs that take place throughout the cities, and that's fine. That we don't want to take away from the impact of the health fair. But what we wanted to do was something greater than that. We wanted to support, elevate, uplift, celebrate Black men in a way that it hasn't been done. So with our festival, what we do is we have a wellness center. So a wellness lounge, so to speak, where men can come and get massages. They can get Reiki done on them. There is a self-care area where they can get, the barbers will give them haircuts, shape-ups. For men who have locks, the loctician will give you retwists. There's also a lady there who's a beauty concierge who will provide manicures and hand massages. And this is all free. It's free because we want to feed people. We want to pour into the community and give them an opportunity to get pampered and sort of just walk out feeling good, feeling poured into. And that's the experience we're creating, and we will continue to create with the Black Men's Health Festival. So when people come in, they walk out feeling like, hey, I have information now. You can get screenings. We'll have prostate cancer screenings, access to colon cancer screening, and appointments that you can make with hospitals like Memorial Sloan Kettering and Weill Cornell, hospitals that you think, unfortunately, if you live in an underserved community, that you don't have access to. But we're here to tell you that you do, and they have programs for you, and they can take care of you. And then we bring in other people to make sure you have access to insurance and things of that nature. So a big part of what we do is just making sure that people feel poured into, they feel loved, they feel wanted, and that they have the information they need to move forward if they're feeling stuck.
Chris, so our Black men, right? I feel like, you know, sometimes we kind of leave them flailing in the wind. And so I thank you for taking this charge, for leading this charge, you know, because we need to be lifting up our Black men. We need to be lifting up our men so that our men are pouring into our next generation. Our men are really the backbone of the home. And so it is so important that these festivals, such like this, that we highlight these things within our community, because our community is undeserved. And not only that, Chris, our men, Caribbean men, you know, there's almost a fear to go to the doctor. There's almost a fear to do checkups and the things that we should normally be doing. So creating a space for them that welcomes them, that nurtures them, that pours into them. It's not just about the health part of it, but also your mind, right? How are you getting right? You know, so I thank you for that. In your opinion, what are the most critical barriers that prevent Black men from seeking regular medical checkups and mental health services?
You know, part of it, there's a big part of it, of course, is financial, right? Because people think they can't afford it. And maybe they believe they can't afford it because they've been told insurance is expensive and so forth. So they don't seek out alternative means of getting the care that they need. Another part of it is cultural, right? You come up, you know, as men, you grow up, you say, man, you're a man, you need to be tough or toughen up don't let that pain stop you. Or, you know, you have mouths to feed. So you have you work 2-3 jobs and you don't have the time. Where do you find the time? Like whatever little pain you're feeling is inconsequential compared to the fact that you have to feed your family. So we push things off because we're taught to not prioritize ourselves, but prioritize our family. When it's actually the reverse. We need to make sure we save ourselves before we can save anyone else. What do they tell you when you're on an airplane?
Yes, put your mask
when you're on an airplane,
first.
Put your mask on first before you try to help anybody else.
Absolutely.
You can't save anybody else until you save yourself. So the onus is on us to make sure that we as men take maximum care of ourselves. Put everything into making sure that we're healthy mentally and we're healthy physically, so we can take care of those that we say we love. Otherwise, the love is not really real. You have to have that love for self before you can really truly take care of others. And so it's going to be a long journey, but for us, we're in this journey to make sure that we do everything possible to break apart that sort of state of hypnosis that we're in, where we believe that we have to do for others before we do for ourselves. We need to reframe our minds and do for ourselves first so that we can take care of others.
reframe our minds. We need to shift the perspective. We need to be the change that we want to see. And Chris, that's exactly what I'm hearing for you. You are the change that you wanted to see when you went through your bouts with your health scares, which I'm sure because you're a young guy. We're young, Chris. I can't even imagine when you got that diagnosis, what that did to your world and to your family. And so, guys, my guys out there, my dads, my uncles, my grandfathers, you heard Chris say, boy, if it's a little pain you feel, you try to push past that. No, this is the opportunity. This is your sign right now. If you're feeling pain, if you're battling mental health issues, whatever it is, the time is now that you address these issues. The time is now to put you first, because we need you. We need you. Chris, we have 3 minutes. Let me just throw you my last question. As co-founder of Where It's At magazine, how do you leverage your media platform to promote health awareness and advocacy within the Black community?
Well, my dad and my mom, and they've always been big proponents of health and fitness and so forth. So for us, and Annette, as also a co-founder, like, we've always made sure that we write articles, that we do different stories on people that are doing remarkable things in the community, especially as it's in the spirit of health and wellness. So it's something that we continue to do with the stories, the features that we have, highlighting entrepreneurs or leaders or community leaders who are doing amazing things in the community that can be a change for what we want to see, as we say. Yeah. So that's some of what we do in terms of the writing. And then, of course, there's the events. A big part of this now, with me having my nonprofit and doing this event, of course, Where It's At is automatically on board as a supporter, because that's also an entity I'm involved with. So, of course. So we make sure to continue to spread the word and highlight these stories. And it's our mission, because we started Where It's At to ensure that as a people we had a platform for expression, and so we will continue in that vein. So we invite people who have who are on these wellness journeys, who want to tell their stories, to share them, bring them to us, so we can take them to our readers and people can be more aware of what's going on.
Chris, thank you for taking the time to be on the morning tea right here on Carib Star Radio. Have an awesome day.